Charlie Eckstein again. I wanted to talk to you a little bit about stone disease. Kidney stones are a very common problem in Middle Tennessee and throughout the country. And it's one of the specialty areas that urology has managed for years and years. Kidney stones form because of metabolic activity in people. They're crystals that form in the kidney, and these actually grow into stones over a period of time. They can be very large or small, but if you talk to anybody that's ever had a kidney stone, it's very painful when they pass. I had the opportunity to see great changes in the management of kidney stones over the course of my career. When I first started in urology, if you had a stone in the ureter, which is the tube between the kidney and the bladder, or up in the kidney, you got a big incision, and we went in and removed it. Well, as time changed, back in 1983 actually it was, we started doing what's called a percutaneous nephrolithotomy, which is to make a very small incision in the back, guide a needle into the kidney, and dilate up a tract where we could pass a scope actually into the kidney and grind up the stone, suck it out through that tube, so you didn't have to pass it, and you didn't have to have a big incision with the 6 weeks of recovery that came with it. Usually with the percutaneous nephrolithotomy, people were over it pretty much in a couple of weeks, so it was a great advance. In 1985, the lithotripter came along. This is a device called a shockwave lithotripter, where the patient's stone is positioned in the focal point of a dish that focuses shock waves. It used to be we put people down in a bathtub, but nowadays we can do it with just a water pad up against their side. But if you vibrate a stone really hard, in many cases you can break the stone up so fine that it will pass down that little tube called the ureter. Another great advance that came along through my career was ureteroscopy. Ureteroscopy basically is taking a scope through the urinary channel, the bladder, and up the ureter to the stone, and then taking a laser and breaking it up into tiny little pieces. Great changes over the last 10 to 20 years in the treatment of stone disease. But now for a kidney stone, we can remove it percutaneously, we can blast it and break it up, or we can go all the way up in the kidney and use a laser to break it up. There are lots of ways to help you with passing a kidney stone. Best way, of course, prevent them. And we can talk about that at a later time, but if you have a kidney stone problem, see your urologist. Thanks.